Representative Allison Russo, and our vice chairs. I know that Vice Chair Senator Sykes is also joining us today. As many of you know, House Bill 110, also known as the Ohio two-year budget, is currently in the state Senate awaiting amendments from the 33 senators to produce the omni-budget bill, which hopefully will be coming out tomorrow. After this budget is introduced in committee tomorrow, there'll be a floor vote this week from the whole Senate, and then that budget will go back over to the Ohio House, where the Senate and the House and the governor will enter into conference committee to get that completed before June 30th. The goal of Ohio's Legislative Children's Caucus is to continue our dialogue, supporting a budget that supports future generations. We know that a healthy Ohio is a strong Ohio, and ensuring Ohio's children are supported and that they're healthy moving forward puts our state in a position to flourish. Today, we will hear from some great guests. Reem Ali, she is representing the Health Policy Institute of Ohio. Joan England, representing the Mental Health and Addiction Advocacy Coalition. And Sarah Kinkade, representing Ohio Children's Hospital Association. I look forward to hearing feedback from all of these parties, and there'll be a time for questions at the end in the chat. So Reem, with that, I'm going to invite Reem Ali to kick us off, and I appreciate all of you being with us today. Thank you.
Thank you, Senator Kunze. I'm going to go ahead and share my screen now. All right. Well, good afternoon. Thank you so much for the invitation to present and share with the caucus. For those of you who are not familiar, HPIO is a nonprofit, nonpartisan organization, and our mission is to provide the independent, nonpartisan analysis needed to create evidence-informed state health policy. These are HPIO's core funders who help make our work possible. I'm going to be speaking about findings from our health value dashboard, which we update every 2 years. And the health value dashboard is a tool to track Ohio's progress on health value, which is a composite measure of population health and healthcare spending. The dashboard also tracks Ohio's performance relative to other states on more than 100 indicators that cut across the various systems and environments that impact both our health and our spending. We just a few months ago now released the 2021 dashboard, which is our 4th edition. In the 2021 dashboard, similar to previous editions, Ohio ranks 47th out of 50 states and the District of Columbia on health value. We rank 43rd on population health and 37th on healthcare spending. What this means is that Ohioans continue to live less healthy lives and spend more on healthcare than people in most other states. Ohio also ranks in the bottom half of states for 4 of the 5 systems and environments that you see here that contribute to health, and access to care is our only relative strength. In examining the data in the 2021 dashboard, we found that lack of attention and effective action across the 3 areas you see here were driving our poor health value rank. And I'm going to focus on that first key finding, which is that the long-term impacts of childhood adversity and trauma are driving our poor health value rank. Ohio sits in the bottom quartile. We rank 39 out of 50 states and DC on the percent of children who have been exposed to 2 or more adverse childhood experiences, or ACEs. And what that means is 1 in 5 children in Ohio are exposed to multiple adverse events, such as child abuse and neglect. Ohio also ranks in the bottom half, sometimes in the bottom quartile of states on risk factors for ACEs. Just as an example, you'll note that Ohio ranks 47th out of 50 states and DC on drug overdose deaths, which suggest that children in Ohio are at a greater risk of being exposed to substance use by a household member, and that is one specific type of adverse childhood experience. The research is clear that ACEs can have both immediate and long-term negative health and economic impacts, with the impacts persisting across generations. There is also a growing body of research that connects racism and other forms of discrimination to ACEs, trauma, and toxic stress. To give a clearer picture of what this looks like, on the left side of your screen, you see that compared to white children, parents of Black children in Ohio are 17 times more likely to report that their child was treated unfairly due to their race or ethnicity. What that means is that 1 in 10 Black children in Ohio are being treated unfairly due to their race. That's 1 in 10. And then on the right side of your screen, you can see how experiencing racism directly impacts health and can have longer-term consequences. With Black adults in our state experiencing more at a rate more than 5.5 times more physical or emotional symptoms as a result of treatment due to race. And that's 1 in 5 Black adults in Ohio. And what these measures demonstrate is how trauma from exposure to racism can have negative health consequences. And although we don't have measures for other forms of discrimination, such as ableism, the research indicates that they do have similar impacts. And when we look at which of Ohio's children are most impacted by ACEs, we see large gaps. And here you see more than 1/3 of Ohio's Black and Hispanic children, and more than half of children with special healthcare needs are likely to experience adversity and trauma. So when we get to kindergarten readiness, which is a measure of whether your child is going to be ready to receive their academic education and move forward with success, Ohio's children of color, students with disabilities, and children coming from economically disadvantaged communities are not ready and are being left behind. HPIO has been working on an Ohio ACEs impact project over the last few years to understand the extent to which preventing ACEs could improve the health of Ohioans. And our analysis found that an estimated 36% of depression diagnoses in Ohio can be attributed to experiencing 2 or more ACEs, and that's just one example that you see in the circle to your left. Another way to think about this is that if exposure to ACEs were eliminated among all Ohioans, an estimated 36% of depression diagnoses could be prevented. That's a significant number. We also found in analysis that we released recently that more than $10 billion a year in healthcare spending and $319 million in lost wages could be saved if specific ACEs were eliminated. That amounts to $1 billion in spending that could be saved in Ohio every year if we were successful in avoiding even 10% of the costs attributable to ACEs. Now, the good news is that Ohio does have the opportunity to advance some meaningful policy change that can remove obstacles to health for children and their families and build resilience in the face of adversity. And investing early in Ohio's children and their families is a critical step to improving health value. In the dashboard, we point to 3 policies highlighted in red on the left of your screen as a starting place to move forward. Being cognizant of time, I won't go into detail on these strategies, but you can go into the dashboard for additional information. And of course, if you have questions about the data or information I covered, you can find my contact information here. And if you're not already connected to HPIO, I encourage you to connect in the ways that you see here, and happy to take questions after the rest of our great speakers present.
Thank you so much, Reem. Next, we will hear from Joan England from Sorry, I'm losing your title. There you go. Executive Director, Mental Health and Addiction Advocacy Coalition. Thanks so much for joining us today.
Thank you, Senator. We appreciate the opportunity to be here. I am Joan England, the director of the, less of a mouthful to say it that way. We are, for those of you that aren't familiar with us, we are a statewide nonprofit focused on local and state level policy that impacts people with mental illness and substance use disorders. I've been asked to spend our 6 minutes today to talk about a report that we recently released in partnership with Children's Defense Fund Ohio, and we're excited to talk to all of you about this. The report, you can see the cover right there, Mind the Gap. It focuses on creating a robust continuum of behavioral health care for young Ohioans. Next slide, Allison. We do want to acknowledge the support that we receive from national and from local and state level funders. Without their support, we would not be able to engage in things like this important piece of research. Next slide. So the report was co-authored by CDF Ohio and the MAC. It takes a detailed systemic look at overlapping systems and unmet needs that impact the behavioral health for young Ohioans. And what it does, and I'm going to talk about this in a little bit more detail in a moment, is it proposes a continuum of care that identifies the type of behavioral health services that should be available at each age and stage of development for young Ohioans. And when we talk in this report about young Ohioans, we are looking prenatal up to age 26, along with their caregivers. And as I'll detail a little bit more later, we also include individual county profiles. So we are looking at all 88 counties and some of the Medicaid data, and in many cases, the unmet needs in each of those local counties, along with data from the Ohio Department of Medicaid on behavioral health conditions and the utilization of services. Next slide. Let's briefly talk about behavioral health prevalence. One of the things we know is that globally, 50% of all lifetime cases of mental illness begin by the age of 14. We also know that nationally, a higher percentage of children and adolescents had a drug use disorder in the past year than adults over 26 years old. In Ohio, more than 500,000 children and youth and more than 500,000 young adults ages 15 to 25 have a mental illness and or substance use disorder. And we know that the rates of teen suicide have spiked 46% over the last 4 years. We also know that more than half of children who experienced major depression didn't receive mental health services, and only 33% received consistent treatment. Next slide. So in the report, we look at overlapping systems of care in Ohio, because we know that a robust continuum of care provides many varied entry points for young Ohioans, and that in a well-functioning system, each entry point is equipped to determine the appropriate interventions depending on the needs of the young Ohioan. Next slide. I'm not going to detail, there's a lot of words and there are a lot of important words on this page, and I would encourage all of you to take a look at this section of the report. One of the things we did was specifically lift up the public health and racial equity impacts of 2020, and I would say 2021 as well. We know that they both have had significant impacts on the behavioral health of young Ohioans. We've seen it, and we know it's going to continue. We're looking at a potential behavioral health surge now that the physical health surge is going down. And we know that it is impacting young Ohioans and their families. So I would encourage you to take a look at this section of the report because it is so important. We do talk about the introduction to the continuum of care in the report, and really the whole report focuses on this. And what this means is really soup to nuts, that young Ohioans should have services that range all the way from prevention services to recovery support services. And every young Ohioan should have those services, no matter where they live in the state. And what we documented in this report is that we know we don't come close to having that, but we know that that's what we should do. So we outline what the continuum of care looks like, and then we surveyed the local ADAMS boards to see what they had available in their local communities and where they had gaps. And again, this continuum of care model includes 11 primary domains, but it's also an evolving framework. Next slide. This is an example of what you'll see in the report. So on the upper left-hand corner where it says prevention and support, we outline all of the services in the continuum of care, provide the definitions so we have a common language around this, and then provide the citation for those definitions. In the lower right-hand corner, you're going to see a graph. So for intensive support services, we list what those services are, and then we list those age ranges that we talked about, prenatal up to age 26 and caregivers. And we say, okay, for this services, this is when this service should be available for these age ranges. Next slide. We also detail the challenges to creating and accessing a continuum of care, and those challenges range from stigma to caregiver lack of understanding, parity issues, funding and workforce issues, racial equity issues, and lack of data, along with more. We also take a detailed look at Medicaid data by age group, behavioral health condition, provider type, service location, and spending on inpatient and other services. We also looked at Ohio MOS data, but I will tell you that the data is limited. They license providers, but they don't identify where they serve young Ohioans. There is a new data system set, whatever you want to call it, that's going to be coming online soon, that's being used by providers to report client level data, but it's not available at this time. Next slide. This details some of the information that's in those 88 county profiles. So you'll see we have state and county statistics, a Medicaid profile, behavioral health conditions among young Ohioans as defined by Medicaid. We also do a highlight of the board counties and the board information from that area, and also behavioral health measures by age group. Included in these county by county breakouts, we also have where available what the local Adams board identified as unmet needs in their local communities. Some key findings. Medicaid is a critical partner in driving policy changes. We also know that many of the Adams boards noted that they needed consistent and timely access to data. And the Adams boards also reported that the availability of services for young Ohioans at each age and stage of development is inconsistent throughout the state. Finally, recommendations. We need to ensure parity. We need to look at the way we fund in this state. We need to address workforce shortages. We need to increase caregiver understanding. We need to address racial inequity in behavioral health. And we need to provide timely access to comprehensive data. And we need to develop and continue to support the entire continuum of care for young Ohioans everywhere to address many of the gaps and ensure access. And Ohio's workforce now and later will be impacted by the behavioral health support we give to young Ohioans today. So thank you. I'm going to turn it back over to the Senator. So thank you very much.
Joan, thank you so much. Next, we will hear from Sarah Kinkade from the Ohio Children's Hospital Association. Thanks, Sarah.
Thanks, Senator. Good afternoon, everyone, and thanks for having me join you today. I'd like to say a special thank you to Senators Coonsey, Sykes, and Representative Russo for leading this important work, and to all of you for participating in this caucus and your leadership in supporting kids. As Senator Coonsey mentioned, my name is Sarah Kinkade. I serve as the Director of Policy and Advocacy for OCHA. We represent Ohio's children's hospitals, including Cincinnati Children's, Dayton Children's, Nationwide Children's here in Columbus, Akron Children's, UH Rainbow Babies and Children's in the Cleveland area, and ProMedica eBuy Children's in Toledo. Our members have the privilege of caring for all of Ohio's roughly 2.6 million children, regardless of their family's ability to pay. And Ohio is fortunate to have world-class advanced specialty care that brings families from all over the country and world to Ohio for treatment. One of the things that we were really thrilled to participate in now 3 years ago was working with HPIO to develop a child assessment on health and healthcare. And special thanks to Reem for talking about a lot of those statistics that had been gleaned out of that report. We know that Ohio is not doing well in our rankings for kids, and having the ability to put a finer point on where those opportunities are, where are the challenges, and what are the buckets that we can be better focusing on as we think about important policy decisions was very valuable to all of our members, and I know all of you as well. One of the challenges that we face in the healthcare system is that when thinking about the driving factors that contribute to a child's health, we know that healthcare serves as a small piece of the puzzle at just 20%. And I think, as Reem pointed out in one of her slides, this is one of the areas, access, that Ohio is doing very well. I think that as all of you are making difficult decisions on how to invest in and appropriate supports to different efforts, maintaining that access to care is absolutely critical as a foundation for kids' healthcare. Here in Ohio, over 1.26 million kids are enrolled in the Ohio Medicaid program, and that's up about 70,000 from the state fiscal year average in 20. So we have seen an increase over time from the effects of COVID-19. And we think it's absolutely necessary that kids maintain access to care in spite of whatever situation their family may see themselves in, to know that they can have robust access to a number of supports, including behavioral health, through that coverage. Kids represent over 40% of the Medicaid population, but account for less than 14% of the cost. And so while we know that kids overall can tend to be healthier and oftentimes cheaper, we sometimes see that as a huge opportunity to better invest in children, because there are so many areas where we are simply reacting to their health needs. And I think that one of the themes that we see over and over again is that the best opportunity to better support kids is through prevention, and making sure that we're better promoting wellness and that we are better addressing kids early on, identifying those adverse childhood experiences and just seeing what challenges they have while they're in school that are preventing them from learning and thriving. We know that that's also a very tall order, though, because when we talk about investing in prevention, we don't normally see those outcomes in a 2-year cycle. And so, but I think the theme that you would see from across all three of our organizations is that when we think about ways in which the budget supports kids and could better serve kids, prevention through not just physical health care, but also behavioral health is paramount. Let's see here. So we believe that Ohio's policymakers can address many of the health challenges our youth face by focusing on 3 categories, and those buckets of maternal and infant supports, chronic disease, and behavioral health. Many of the things that our members have been doing to take ourselves outside of that 20% in that healthcare space that influences a child's overall health and wellness are oftentimes not supported in any way. And so providers have to become very creative to take on these additional challenges that kids are facing and that families are facing to make sure that their needs are being met upstream as soon as possible. OCHA was supportive of the introduced version of the state biennial budget this year, which proposed a continuation of investments in kids that had begun in the previous budget cycle. And thank you all for your support of those investments and specific services. Under Medicaid, we've seen an expansion of the comprehensive primary care program for kids that all of our members have participated in. And that's been a really crucial effort to ensure that kids are seeing supports early on, especially in 2020 during the pandemic. We saw a massive drop off of kids' wellness visits, and we've utilized the program to better communicate among providers and plans how we can communicate with families to make sure that those well visits come back on track and that we are not having kids slip through the cracks from missing those purposeful timed visits. We've also been supportive of the creative ways that lead abatement and related activities have been addressed. And Ohio, in recent years, began efforts to utilize additional federal funds to support those lead abatement and related activities. So we're very supportive of continued efforts in that space and the creative ways in which different organizations have addressed kids' access or exposure to lead, which is another area in which Ohio could see some significant improvement. We were very grateful to see the proposed expansion of postpartum coverage for mothers to 12 months. Right now, the policy here in Ohio is that moms only have coverage in Medicaid for 60 days, which is a blip in time for anybody who knows what it's like to be a new mom. And we are hopeful that that's something that will remain in the budget that is signed by Governor DeWine here in the next few weeks. I think that that's also a massive opportunity to address some of the behavioral health concerns that we see with kids early on when we talk about addressing ACEs. Having those interventions and making sure that mom is supported is really low-level hanging fruit, and thinking about how we can ensure that mom's wellness is directly tied to a baby's ability to thrive. And then finally, I'll mention that under the massive changes that have been undertaken under Medicaid over the past couple of years, we have been supportive of the recognition that the current system is really not serving kids well, especially for those who have unique, complex behavioral health needs. And so in particular, the creation of Ohio Rise is something that we are very eager to see come live here in 2022. We've had a number of clinicians and other experts participating in those work groups to make sure that the design of that best meets the needs of families and children who are experiencing really high level complex challenges that the existing landscape of supports is not addressing. And I think that children's hospitals are one of the, have an unfortunate front row view in what happens when kids get stuck. And because there are no placement options for them to go, they are not thriving, they are not best served sitting in our emergency departments. We've come up with a number of creative ways to divert care and attention and expand behavioral health services. But as anybody in the pediatric delivery service under behavioral health knows, it is not meeting demand. And we were already in the midst of a crisis before the pandemic that the last year and a half has accelerated massively. So I think that, we see this as a dual opportunity to address those complex services through Ohio Rise, making sure that we're building up a better network of care for kids in crisis. And at the same time, we are advocating heavily to expand prevention opportunities. We support anything that would, the integration of behavioral health into primary care would do wonders for addressing stigma, while also freeing up our workforce shortage that we have in the specialist area. If we have our psychiatrists and psychologists better able to respond to those with the most acute needs and have other behavioral health providers available and in the pipeline to serve families earlier on, that will significantly help address our wait times. And so actually, I know I mentioned that was one of the final things, but one other final point that I should add is that we have been supportive of the student wellness and success funds that have been created to and very purposefully support kids' wraparound services in school. One of the challenges that we have as pediatric providers is that we only have a small window of access to kids. And we know that for the K through 12 population, kids spend the majority of their time in school. If they are not able to focus while they are there, then we're losing them early on. And so while all of our members have engaged in a number of different school-based healthcare models that are tailored specifically to meet the needs of their community and their school district that they're partnering with, we think that having purposeful funds dedicated to those efforts is incredibly important, and we support the continuation of those efforts. So I will stop there. I think I'm over on my time anyway, but thank you all. We're eager to answer any of your questions.
Well, thank you. I'm going to jump in. Representative Allison Russo, co-chair of the Children's Caucus, and thank you to my colleagues, Senator Coonsey, and I saw Senator Sykes on for facilitating the beginning of this presentation, and to our wonderful presenters, Reem, Joan, and Sarah. Good to see you all, even if virtually, to present this fantastic information. I do want to open it up to questions. I know we have a number of legislators who are on. Also encourage folks to add any questions that they may have for our panelists along the side or in the chat box, which I will be able to see, and we'll try to facilitate those as well. If you are a legislator, just take yourself off of mute to ask the question, and I'll just kind of kick us off a little bit. As was mentioned before with Senator Coonsey, we are in the middle of the budget discussions, and when we saw the budget come out of the House, it went to the Senate. We saw the changes to the Senate budget, which I know our Senate colleagues are still working on in the form of amendments, and we'll be taking that through the process and voting it out soon. But there were a number of changes I think that touch on some of the issues that you all brought up in this presentation, specifically around, there's some changes to some of our lead abatement programs and funding, our Medicaid contracts, and the way those are structured with the reprocurement process, our K through 12 funding issue, as well as some changes to the quality program, Step Up to Quality for early childhood education. If you would just kind of talk to, what are any concerns or opportunities that you see in terms of, these potential impacts on children's health outcomes? And I know that's a big question, but, what are maybe some things that you would like to see addressed, or concerns that you may have with some potential changes? Maybe we'll start with Reem. As specifically, I'd be curious to hear what you have to say, especially we know that the Medicaid managed care contracts were really structured this time to look at things like social determinants of health, directing at the Ohio RISE program. Any thoughts that you have just to start us off on that question?
Sure. Well, I think it's certainly a step in the right direction. The areas that we highlight in the dashboard where there could be increased focus and attention move out of the healthcare realm and more into, again, the social drivers of health or social determinants of health realm. And I'll talk primarily around education and all of the changes that are being implemented around K through 12 funding, but just making sure that whatever changes are being implemented can help to address what we see as widening academic gaps. There were already, and I think Sarah touched on this, there were already gaps in education outcomes across our state, and the impact of the pandemic has only exacerbated that. And so if there are any funds that can be devoted to addressing education outcomes, particularly, or improving education outcomes, particularly for those that have been most disadvantaged, things like addressing chronic absenteeism, providing school-based health services, as Sarah had indicated, would be incredibly important, and providing those wraparound services. So I think that's an area, if we're talking about child well-being and preventing childhood adversity and ensuring that our kids are ready to succeed, that's an area where there can be, I think, more concerted attention and focus on addressing those children that are really most in need.
Did any of the other panelists want to add to that? I see, Joan, you took yourself off of mute.
Yeah, I'd like to jump in on a couple of things. The student wellness and success funding, we were pleased to see that the Senate had added $650 million back into the budget and into the funding for that. We know that the needs of kids were great before the pandemic, right? The needs have only gone up since then, and kids and young Ohioans in Ohio need those behavioral health supports. So we're excited and really thankful that part of the funding was added back. One of the concerns, though, we do have is we'd like to see the restoration of the language that the governor had in the as introduced budget, which required partnerships with community behavioral health providers or prevention providers or the local ADAMS boards to really help ensure that those dollars are dedicated to the services and the needs of local young Ohioans. So that's one of the things that we're watching. We're also very concerned about the potential for delay in the managed care reprocurement and the potential impact on that for Ohio Rise. Ohio Rise is going to take our state and the lives of young Ohioans and Ohioans around the state to a next level, a level that we haven't seen before. It has an opportunity to really change the trajectory in the lives of so many people, and to delay that and endanger that work after years of work has gone into that is something that we're terribly concerned about.
Thanks, Representative. I'll chime in as well. Just to add that, as you pointed out, we're still waiting on the final version that I think we'll see here in maybe about 24 hours or so of what the Senate's proposal will look like as those options go into conference committee for discussion and debate. We'll see a final product. But to echo what Joan said, I think that while we know that there are significant changes on the horizon with the program and that there are probably no shortage of voices who have opinions on how to make improvements here, we want to make sure that any final product of what goes forward as we look to change the Medicaid program, beginning in 2022 and beyond, has that special attention for kids. And we feel that the Ohio Rise program has a really unique window. We have not been able to see another model in the country that is taking it on at this level. And so while that can be scary because Ohio kind of going out as the leader and trying to take on these complex behavioral health needs that are not addressed today and often lead families to be forced to send their kids out of state for placement. It's something that we think is absolutely essential to make sure that the foundation of supporting kids in any Medicaid transformation continues on in the final product of the budget.
Thank you all for those responses. Do want to give our other legislators who are on just an opportunity. I don't want to ask all the questions. If you have a question, just take yourself off of mute, or if you just have a comment. I see Senator Sykes.
Yes, good afternoon. Thank you all for your participation. I'm concerned about behavioral health and how is that diagnosed with children. Since it's so important, we understand and have more and more concern about being able to recognize it and treat it as soon as possible. So how is it diagnosed? Is it that the caregivers or parents or guardians seek assistance for their children, or how else might it be diagnosed?
I can jump in and get us started on this, perhaps. I think that's a fantastic question, Senator. It's one of the things that when we look at the continuum of care and really building that out in Ohio, it goes back to that overlapping systems, right? A child could be referred to care because of something that happens at school, for example, or their parent could see it, but only the parents have to understand what a behavioral health diagnosis is, right? So part of building out a continuum of care ensures that parents understand what mental illness and substance use disorders and the impact of those might look like, so that they could then perhaps take it to their pediatrician, like Sarah was talking about, who then with an integrated system would have access to a child psychiatrist or a child psychologist if it was something beyond what they felt that they could diagnose. But I'll go back to mental illness and substance use disorders are illnesses or diseases of the brain. They're like all other medical conditions. And we're finally getting to the point in this state and in this country and in the world, I think, where we're really starting to increasingly appreciate that, understand that these are illnesses that need to be diagnosed like other illnesses. But what we have to do is build a system where one can access the care that they need and obtain the diagnosis they needed through no wrong door. So whether it's a referral from school or their pediatrician or whatever it may be, that people can get the care they need through a variety of doors.
Thank you.
I'm just going to add to what Joan said is when we're talking about the diagnosis of behavioral health issues, I think it's important because sometimes, particularly for specific groups of children, like Black children, Hispanic children, children that maybe have English as a second language or come from more economically disadvantaged communities, what is considered to be a disciplinary issue in school might actually be a behavioral health issue that needs treatment. And so while the diagnosis is important in that respect, and then at the same time, of course, diagnosis is important, but treatment is also important. And so making sure that there are adequate treatment services that can be provided and that's easily accessible to parents and children is also critically important. So it's the two pieces come together. You can have diagnosis, but then do you have the access to services for children as well?
Is there any periodic review or assessment done in the school systems?
So for behavioral health?
Yeah, for behavioral health.
Yeah, I am not a school-based person, but I would say that I'm not aware of any. But one of the things that we have talked about is well child visits. So kids and their families will go in oftentimes for a yearly well child visit with their pediatrician, for example. And one of the things that we've advocated for is that as part of that well child visit, that the child's behavioral health should be looked at to the same extent that their physical health is being looked at. And we need to be doing that on a year by year basis, starting all the way from the earliest of appointments. We were talking about the extension of Medicaid for mothers a year after birth, right, versus 60 days, really looking at the health of the mother and frankly, prenatal, because we know the impact of maternal diagnoses and illnesses on a child. So really looking prenatal on a regular basis at mom early on or caregiver early on, but also that child on a regular, at least on an annual basis, like we look for other physical health disorders.
Thank you.
And Senator, I would just add that, so I believe that each school district has the authority and ability to utilize whatever screening tools they'd like to participate in, whether or not they have a formal partnership with a provider or some other engagement. We are strong advocates of more broad screenings to ensure that kids are not slipping through the cracks, but equally important is making sure that they have places to go once they are identified. And that's one of the issues that we're faced with every day in a workforce shortage in behavioral health, is that even when it's determined that there is a child at risk, there is an unacceptable wait time because we do not have enough behavioral health providers in the state to meet those needs. And so that's one of the other reasons why we're so supportive of those early interventions and efforts that promote social and emotional wellness, giving kids the tools early on to be able to manage their emotions. We know that kids are going to be faced with challenges, and if they feel that they're better equipped in a school setting to process those challenges, it can greatly impact the ability for us to almost triage who needs to then be referred to higher specialty care and who is equipped with those tools that allow them to be more resilient in the face of these challenges that they're faced with today.
Thank you.
I see that Senator Fetter has her hand raised for a question. Senator Fetter.
Yes, good afternoon, everyone. This has been a fantastic conversation. I wish all of my colleagues, both House and Senate, could be educated in your specialty area. And, this area is so relevant to so many different aspects of raising a family, right? And so I think about all of the new initiatives that we're doing. And Sarah, you had mentioned identifying children and being able to give them the tools. But I'd really like to hear really the efforts as we go along. Maybe the next conversation would be prevention. I mean, do we need stronger health education standards? I mean, do we actually, want to be the last state in the nation to provide those? And we need, the children's hospital organizations to back us up on that. I mean, we've had great leaders, Vernon and Stephanie, in that area. We can't advance, I don't think, in the area of prevention unless we're giving them the tools up front. And do we need more after school programs to help children tap into their talent and creativity to keep their focused on something that's going to help them battle those areas that you talk about? So, I'm really interested in maybe elevating the solution to begin with in prevention and, really providing the same type of effort in financial resources in those areas. So, there's just a whole lot of things that we can do in the prevention end of things. So, yeah, I do support a system that's helping us identify and then giving some solutions forward, building the on-ramp, if you will, for families and schools. But also my next question is, how do we improve and support the wraparound service education model that we now have through House Bill 70, the purity of House Bill 70, not the state takeover, but the wraparound services is such a great solution. I'm not sure your industries know about that model. And if not, should we really try to mesh some of the things that we've got going in Ohio to help, really provide that foundation you're talking about for our kiddos? So that's a whole lot, but I can't help think about prevention and how we need to build a system where they don't even have to worry. No matter what economic status they're in, they can start tapping into their talents and creativity and through public education, really get to that. So those are my thoughts.
Thanks,
I want to
Senator.
respond.
Those are great points. And excuse me, I would say that, we're in full agreement that prevention is really the critical piece here to making sure that we get the biggest return on our investment. And I think that the more that we've learned about not only what children's hospitals, but what other partners are doing around the state, there's a lot of really exciting pilot projects and smaller efforts, but it's about bringing those to scale, bringing evidence-based work to a statewide level so all kids have access to those wonderful programs and building that continuum of care that Joan talked about. One example that we hear about all the time is the PACS Good Behavior Game, and that's something that's being supported and through the state right now. But anything to expand it, we see really incredible results there when we're talking about these small creative changes that take place in the school setting with kids, and the ability to the question that Senator Sykes brought up earlier, identifying when a kid is struggling, having someone in the early childhood space and in those younger years have a support with an adult to be able to manage those emotions. And we see those models that are out there, but bringing those to scale and investing in them in a more statewide approach is something that I think we're all behind. I don't know if Reem or Joan have anything to add.
I would agree with Sarah, is that some of the issues that we see, there's lots of things that are happening across the state that are terrific, they're fantastic, but it's really about bringing it to scale. And so that's one area. And then there's also kind of this distinction between what are protective factors for our children and promoting the protective factors that can help them in combating adversity and combating trauma, and then also preventing what are the risk factors. And so if you have a child who is living in poverty, or have a child who is unstably housed or food insecure, those are all stresses and traumas that then contribute to their poor health outcomes. And a lot of times we hear about focusing on schools and focusing on education. I mentioned it earlier, but it's equally important to make sure that children have their basic needs met, that they have adequate and stable housing, that their families have adequate incomes to be able to provide for them. And those are some of the risk factors that are often missing from the conversation, and that are often much more challenging to get policy around, takes greater investment, and but are also equally important to address. That's just the only other part I would add. Scale up what we're currently doing, and then also really invest in those foundational factors, basic needs, to make sure that our children are set up for success.
And I would just add, this is also, to put it on the table, this is an area where we are behind, right? I mean, this is an area where we haven't been making investments through the years. It hasn't been an area that's been financed. So because it doesn't have a financing mechanism in many cases behind it, we haven't been implementing a lot of prevention historically. So it's an area where we've got to really kind of pivot on a dime now and really lock in to really focus on this area, particularly as it relates to kids. But again, it's part of that continuum. But I would be remiss if I also didn't lift up, was mentioned earlier, the workforce issue in this plays such a critical role. We don't have the behavioral health workforce that we need, and we've got to get them into the pipeline, and then we've got to find ways to recruit them, and then we've got to find ways to retain them. Much of that relates to financing again, and that is a big nut that we still need to crack.
So, speaking of good returns on investment, we did have a question in the chat specifically around Step Up to Quality, the state's quality program for early childhood education for publicly funded childcare. In the version of the Senate budget that we've seen so far, there was an elimination of the Step Up to Quality program. We'll see what changes evolve over the next week or so with my Senate colleagues. But would anyone care to address, the question specifically was, do you believe that these changes, eliminating this program and eliminating the quality piece, will have an impact on the health of children, families, and childcare professionals across Ohio?
I would defer to my colleagues or maybe others on the call for this one. I wouldn't profess to be a child care expert. I know what I think in my heart, but I wouldn't want to speak on behalf of the organization. So I would defer to my child care and education colleagues.
Okay. Well, go ahead.
Well, to echo what Joan said, I don't know that I'm well versed enough in that program to be able to speak to it. It was my understanding that it was switched to voluntary. We're looking forward to learning more about what kind of impact that might have, because the early childhood space is obviously very important to a kid's development. I think with a few minutes left, though, I would be remiss if I didn't use that as an opportunity to pivot just slightly away from the budget as we're thinking about early childhood, and mention a piece of legislation that is over in the House right now that we have a lot of concerns with the impact on early childhood, and that is House Bill 248, that would really dismantle our immunization work that has gone on in the state of Ohio. We feel that the current law provides adequate choice to families in their ability to decline vaccinations. There's not a vaccine that is mandatory for kids in Ohio, but we have an opt-out system that we think is most important, and tying it back to the motivations that families have to get into those well child visits and have those developmental screenings. We know most people are supportive of immunizations, and I think I just want to, do a quick plug to say that as you guys are considering the landscape before you and how to best support child health, that's obviously not within the budget, but a separate piece of legislation that we have some pretty major concerns with.
So Sarah, actually, that was going to be one of my questions for you. So thank you for bringing that up. Can you talk a little bit, and I'm glad that you did pivot there, and that piece of legislation specifically, and the concerns that you have. And I noticed that your organization, as well as about 50 others, really from across different sectors of the economy, children's health, business, community, came out and really spoke out against that piece of legislation and bringing up some of the concerns that they had as a group. But can you talk just a little bit about what we have seen with childhood vaccination rates here in Ohio, especially in the last year with COVID and its impact on just utilization of those well child visits, but just overall what we're seeing with childhood vaccination rates?
Sure. Thanks, Representative. We really did see a massive drop off. This was not unique in Ohio. The CDC had put out a report that one of the most concerning effects of the pandemic early on is when things had shut down in the spring. We saw, I think it was about a 50% drop off in well child visits where kids were not getting their vaccines that they had been on schedule to receive, and the curve to bring kids back in, get families to feel safe to come back into the healthcare setting and get back up to speed on those immunization schedules has been an ongoing effort for some time now. I think that as I mentioned before, the majority of families are supportive and very interested, want to have their kids vaccinated. It's a unique privilege in the United States that we have access to vaccinations that make it so that these some of these infectious diseases that oftentimes were just abhorrent in what they were doing to child health outcomes have been virtually eliminated. And seeing the emergence of those come back in these flare-ups is very concerning to pediatric providers. So that's been one of the things that we've been working very heavily towards, is bringing families back into the healthcare setting for their well child visits, not just for those developmental screenings and making sure that the family is safe and secure and everybody is doing well, but getting them back on that immunization schedule so that if in the daycare setting or in the school setting, as people are returning to life as normal and you have kids congregating in that larger area, well, we're very fortunate that for the most part, the COVID-19 has not had the same type of health risks on kids as adults. There are kids who kids are getting out at the same rate, and kids are at risk of becoming seriously ill, but it's not at the same level as older, more at-risk populations. They are at risk of these diseases that when you have less and less people getting immunized, they're going back into the daycare setting, they're going back into schools, being exposed to one another puts us at a red flag in that space. So I don't know if that answers your question. I'm starting to ramble there a little.
No, it does. Thank you. And thank you for bringing up that important piece, which I know wasn't in the presentations, but is such a critical component of children's health outcomes and good outcomes for our kids here in Ohio. Well, we are at the end of our caucus meeting. Thank you all again to our panelists, Sarah, Joan, Reem, for the excellent presentation, for the very hearty discussion with my colleagues afterwards. We could probably spend most of the day here talking about these issues. There's so many to talk about, so many important things to cover. For those of you who joined us online or in this webinar, thank you again. We continue to meet about on if not a monthly, a bi-monthly basis, talking about the important issues that impact Ohio's children. So we appreciate you joining us and continuing to engage in this conversation. So have a good week, and